Hi, I'd like to welcome Dr. Medina tonight for our talk on vaping, a public health crisis. Dr. Medina is the Pediatric Director at Tri-River Health Center in Uxbridge. He's also the Assistant Professor of Pediatrics at UMassChan Medical School, the School Health Consultant for DPH, and school physician for the Northborough, Southborough School District. And here he is, Dr. Medina.
Thank you so much for having me, and thank you for organizing this. As you know, this is a public health crisis, and I hope to give you an overview about vaping as it involves nicotine and marijuana, as well as hopefully giving some practical tips for parents. So, why do teenagers vape? I think this is the big question that, for adults is what's the attraction to this little device that they can blow things out of and blow air into their lungs? It's because, we know that their brain does not develop till they're 25 years old. And so this is a brain that loves risk-taking, thrill-seeking, and there are no filters in their brains, as you all know, being parents of teenagers. And they want to live in the moment. There's no thought about consequences 20 years down the road. They definitely feel invincible. I'm a teenager. Nothing's going to happen to me. If something happens, it's going to happen to the other person, not to me. And of course, the moment they see their peers do it, they want to do it too because they have a desire to fit in. I specifically chose this pictures because, as you can see, there is a lot of online advertising. Although there have been laws that now restrict online advertising, these things are not easy to find for your teenager online. They are inundated with ads on their social media feeds. Next slide, please. And so the best thing to do is ask them why they vape, right? And this was done in Michigan. Monitoring the Future is a study that's done every few years with tens of thousands of teenagers. And most of them said they do it to experiment, about 61%. Some like the taste, but thankfully, in Massachusetts at least, we have banned all flavors of nicotine. We have not banned THC flavors yet, but we banned nicotine flavors. A lot of them do it to have a good time, to relax and relieve tension. That's a significant number, as you can see, about 37%, which indicates that a lot of them are using substances, be it nicotine, alcohol, or THC, to self-medicate. Sometimes just to feel good or get a high. Boredom, so the more activities we can provide kids, the less likely they may be to use a substance, and because it looks cool. And we have to remember this as adults, that their brains are not like our brains. If we say, I'm going to have a glass of wine to relax and go to bed, well, your teenager is looking at that, but their brain is very different, and they're going to react different both to the wine itself and its after effects. So addiction begins in childhood. We know that brain is vulnerable. Anybody who is addicted to a substance, whatever it is, you can ask them, and I guarantee you they'll say that their first smoke, their first drink was when they were a teenager. Casual use can lead to dependence for any substance, pretty much, and specifically to nicotine, it causes cell damage to the adolescent brain, and that specific cell damage that it causes is not found in adult brains. Next slide. So just talking about nicotine in general first. So nicotine addiction is very, very problematic. It's the most addictive substance we have. So, nicotine level in somebody falls who's smoking cigarettes or vaping, and their brain immediately generates a crave for nicotine. They have to inhale that nicotine to get rid of that craving. Their brain releases that dopamine. They feel better, but the moment that dopamine goes down and their nicotine level goes down, they want more of that nicotine. And this is a cycle that they just cannot get out of. And if they don't respond to that crave that they get, they'll develop symptoms of withdrawal. So what are these kids doing with these Juul pods? So these are really potent. A single Juul pod is a pack of cigarettes a day. So we have to ask kids, how long does a Juul pod last you? If they say a week, they may say a week. They may say a day. They may say I use 2 in a day. That's an important question. It's important for us to know that there's a lot of nicotine in that one Juul pod. That's not a cigarette. That's a pack of cigarettes. And menthol, I do want to make a quick comment about menthol. So menthol is a very specific flavor that was deliberately added to cigarettes and vapes. It is thankfully banned in Massachusetts, but not banned in other states, so it can still be purchased online. So we have to be careful with that. So menthol, high menthol juices, even with low amounts of nicotine, are more likely to cause addiction because menthol inhibits the metabolism of nicotine, so your nicotine levels stay high for a longer period of time. It actually dilates your airways, so if you have more surface in your airways, you're going to absorb more nicotine through your airways. And in your salivary glands, you'll increase blood flow and get more nicotine through that way as well. So this was very deliberate by the tobacco industry and the jewel industry to add this to nicotine products. Next slide. So what do teens want? So believe it or not, once they start realizing that they are dependent on nicotine, they actually want to quit, which is really, really amazing to hear because so many are vaping. And the reason is because we've actually, as adults, done a very good job of educating them on the harmful effects of nicotine, the links to cancer, and they do see a lot of the adults in their lives, struggling with nicotine addiction. So more than 60% want to quit. So that's why we want to act on it. If we find a student who is vaping nicotine, we got to act on it immediately. Next slide. So what can we do? Back one slide. And right, okay, oh yeah, this is the one, sorry, okay. So we want to develop a plan. So you want to set a quit date with them, because maybe that'll motivate them. Maybe it's Christmas, maybe it's their birthday, maybe it's an upcoming dance, whatever it might be. Talk to them about how they can remove nicotine products from their life. Do they want to stop buying them? If there's something in their room, have them give it to their parent or somebody else. Do they want to reduce or try to quit cold turkey? There's no right answer. We can try. Motivational interviewing, which I'll talk about, and that takes weeks of appointments with somebody trained in motivational interviewing, whether it be their primary care doctor or a mental health clinician. Talk to them about the withdrawal symptoms they'll get, whether it's irritability or anger, and how they can be supported through that. Obviously, treating any underlying mental health conditions such as depression and anxiety. There are various apps out there that I'll show, as well as options for nicotine replacement therapy. So, motivational interviewing, health concerns. Believe it or not, 75% of them are worried about health concerns of nicotine, and that's simply because they have already read about them and they see them in the media as well, so they're very in tune to that. Cost. Ask them how much a jewel pod costs. It costs a lot of money, $25 or more, or even more. So that's a lot of money they'll save. Their physical fitness. Are you more physically active, better or without? Better, and a lot of them will say, wow, do you think I'm really going to breathe better if I don't inhale anything? And you can say yes and let them try. And finding a peer group that doesn't vape. It's challenging for them. It may mean changing their friends, but ask them to name even one friend who doesn't vape and maybe have them spend more time with that friend. And, treating mental health is key, of course, if they have depression or anxiety, whatever mode they need, therapy or medication. Stress reduction. Yoga actually is a very effective way to reduce nicotine cravings. I think it's a hard sell to a lot of teenagers, but I definitely throw it out there. Management of their sleep. And obviously, these are the withdrawal symptoms that they will experience. So these are the things that we want to make sure that we are ready for and support them through anger, irritability, increase in appetite, mood and sleep disturbances. And these are some apps that are available. These are apps that have been studied and endorsed by DPH, My Life, My Quit, Smoke Free Teen, and Quit Start. They're great because kids can interact in real time when they have a craving. So, their world is the digital world, so this is something they do respond to very well. And, having them download these apps may help them significantly. And there is the option of nicotine replacement therapy. We do offer it to kids. These nicotine lozenges are approved for teenagers. They have to be prescribed by a clinician, so if they're prescribed, the students can have them. And if they want to try a piece of gum throughout the day to see if that reduces their cravings for nicotine, that's great, for smoking or vaping it. And then hopefully they can gradually reduce the amount of gum that they use. Please remember, they cannot carry that around the school building, so that is with the school nurse, and if they need it, it's like a medication order for anything else from the doctor. They need to have that stored with the school nurse, and they're more than free to go get it if they feel a nicotine craving. So that is an option that's available. So switching gears to the new big tobacco, big cannabis as I like to call it. We're behind right now on our education of cannabis to our kids. So while you get this desire to quit nicotine, there is not that same desire in a lot of kids to quit vaping or smoking THC. Because social media messages seem to give them the opposite message, as you can see, both with flavored vape products out there and, telling kids that marijuana will work for pain when opiates don't, which unfortunately marijuana, there's no study that validates that marijuana actually helps chronic pain. And we know, that kids are seeing more and more marijuana drugs. And in California, they followed kids for 7 years and found that the number of teens who saw an ad increased and the number of teens using THC increased, of course. And in California, they've studied the effects of legalization, and of course, no surprise that they found a significant increase both in lifetime use of 18% and in past 30-day use of 23%. And Massachusetts has legalized recreational marijuana, of course, and these billboards that we see on the Mass Pike that we've all seen, kids look at those billboards. They really do, and it's probably incumbent upon us parents to really talk to them when they see that billboard. And maybe that's a good time. They're trapped in the car with you, and they see a cannabis ad. It's a great time to talk about how harmful cannabis can be to them. So I did pull some data from the Metro West Adolescent Youth Risk Behavior Survey, just so you get a rough idea of what's going on in the state with marijuana use. So as you can see, there's a sharp rise in high school from 7% to almost 39 to 40% in 12th grade of marijuana use initiation, and a quarter of high school seniors report past 30-day use. And then what's really, I think, troubling is that more and more kids now perceive marijuana as being a safe drug. So the number of kids who saw using marijuana once or twice a week risky fell from 58% to 51% over that time span, and I would argue that it's even less than that now of number of kids who actually think marijuana is harmful to them. This last thing was that 48% said that it was fairly easy or very easy to obtain it in 2021, and that was down, and that's because this was taken during the pandemic. So we're probably back up to that 64% or even higher now of how easy it is for kids to get marijuana products. So what is our clinical experience? What's the experience on the ground? So kids are more likely to use cannabis than alcohol or nicotine to self-medicate. If I ask them, I need to calm myself down at night. I'm too anxious when I go to school in the morning. And it's really, really fascinating to me when I have this discussion. Yeah, smoking or vaping nicotine is going to harm my lungs, but smoking or vaping marijuana won't. And it's somehow built into them to think that. And I think, I'm sure, Karen, you hear the same thing day in and day out. Oh, that's not going to harm my lungs. So I really have to have this discussion with this. It's the same thing, guys. You're putting a substance into your lungs that's going to harm your breathing. So it does have respiratory effects. So what we do know is that it does have some of the same cancer-causing substances that are in tobacco smoke. However, in all truthness, we do not have a direct link to smoking marijuana or vaping marijuana and cancer like we do with nicotine. So it's important to tell kids the truth about that, but it does contain some of those cancer-causing chemicals. But it does weaken how your respiratory system works, and you are more likely to cough or wheeze or reduce your exercise tolerance. So it goes back to that nicotine thing again. Can you breathe better with it or without it, and try to give them a challenge? So this is definitely not new to schools, this syndrome called cannabinoid hyperemesis syndrome. And we see maybe 2 to 3 of these kids a week in primary care. UMass Memorial did a study, this was back pre-pandemic, through the month of November and December of 2018, they admitted for dehydration at least 1 teenager a week with this syndrome of vomiting from marijuana. And they'll have nausea, vomiting, abdominal pain, and diarrhea almost every morning because of their cannabis use. And it can only be 2 or 3 times a week. It does not have to be every day, does not have to be right after they use it. Interesting enough, they all feel better after they take a shower. So unfortunately, they don't make it to school on time a lot of days because of this, or they end up with a lot of missed school because of it. So it's really important for us to warn them about it and support them if they do have this syndrome. For boys, this may help. This data often helps them significantly, knowing that it does decrease their testosterone levels. So it can lead to erectile dysfunction. It can lead to low sperm count and development of breast tissue in boys. And I always tell boys this, I have had at least 2 patients I can think of that to have surgery because of breast enlargement from marijuana use. And then what we all really focus on is the psychiatric and neurologic effects, which is obviously a decrease in their IQ, as well as increased risk for depression, anxiety, suicidal ideation, and the big thing is psychosis. So a huge increase, likelihood, 40% more likelihood to develop psychosis at a young age. And I have to tell you, just from what I've seen, nothing is more, I don't even know how the word to describe it. It's just so sad when I'm with a parent whose child is going through a psychotic event or hallucinating. It's very painful to see from marijuana, and knowing that it could have been preventable. And the academics. I think one of our messages has to be to kids that the marijuana of today is very potent. And for us parents to understand, the marijuana of 40 years ago was maybe 2 to 3 to 5% THC. We're looking at things like 12 to 15% minimum THC. So this stuff gets into the brain, binds to the brain receptors for long periods of time and stays there. So, I love this study that was done because even those who smoked on weekends had lower test scores than those who didn't smoke on weekends. So that tells you that this casual use over the weekend can still lead to a decline in grades. And this, impaired driving. Again, we have done a really good job with alcohol and driving. Almost every teenager that I see will say, I will never drink alcohol and drive. They will not say the same thing about THC at all. And we know that THC causes impaired driving. The data shows it significantly. Multiple studies have shown that. Your judgment's poor, your motor coordination is poor, and your reaction time is poor. When you tell a teenager this, their first reaction is, well, I just feel chilled. How's that going to affect my driving if I'm chill? And I have to say, well, your reaction time. Think of a car pulled out in front of you. You're going to be too chill to hit your brakes, and you're going to hit that person. And really explaining what it does to them, because they really do not see that. And again, part of it is we have not had that robust public health campaign that we've had with alcohol and driving. So how do we know that our child is vaping too much THC? You're going to see all these signs that they just have a strong desire to use it. They're going to start lying. They may steal money because they cannot stop using this. They tried to cut down. You tried to work with them to cut down. They could not do it. They can't. Their grades are declining. Maybe they had a part-time job that they no longer can function in. They can't play their sport well or play their instrument well. They want to give up those recreational activities. They're losing all their friends except for the ones that they use the cannabis with. They're using at school because they really have a craving at school, and that's a problem. That's a problem, obviously, if they start using at school, the driving and withdrawal symptoms, which I'll go into because they're a little different than other substances. So although we're talking about vaping, because we're talking a lot about THC, we have to talk about edibles. Edibles are a whole different ballgame here. Now, you can buy those baked goods in Massachusetts as well as gummies. You cannot buy those products that are on the far right in Massachusetts. Those are banned, but they can be bought online. And as you can see, they're very cleverly designed to mimic candy that we otherwise see. The problem with these is it's a delayed onset of action. You have to go through your GI tract and then get to your brain, which takes a little while. Now, for that teenage kid that wants that immediate high and their brain wants it, they don't get a high from a bite of a brownie. What are they going to do? They're going to eat the whole brownie, waiting to get that high. The high they get is from that initial bite they had, but there's the rest of that brownie still left to give them that high. And really just a serving of these can land a child in the ER or even an older teenager into the emergency room because there's so much THC in these things, whether it's from vomiting, whether it's from a panic attack, or whether it's from acute psychosis. And, marijuana vaping is its own challenge because there's no smell. We all know when you smoke, there's that telltale smell, and you can smell it on the child, you can smell it in the room that they're in. It does not hold through for these flavored vapes, and they're really high. Some of these things have 95% THC in them. So, and those are not banned, so those are available still in Massachusetts. So, before the pandemic, we all heard a lot about these lung injuries that were occurring in young people. The CDC stopped keeping track. I did have a patient with this last year. But I think it's important that kids realize that this can happen to anyone. And that's the point of showing the slide. We know that scare tactics often don't work with kids, but it's okay to mix every now and then to mix something like this in with other, encouragement that we give kids, because this was a high school cross-country athlete, and it started because he couldn't compete due to a knee injury, and then he started vaping nicotine, then THC, and then obviously ended up with, the EVALI or lung disease that kids get from vaping, and ended up with a lung transplant because of it. So, and he went very public with his story. His video is available online to watch. So again, scare tactics don't always work, but this is a story to share with them so they really, really understand that this can happen to anybody. And one thing to caution, we were talking about this before the presentation about alcohol. Alcohol rates had actually started to decline in kids before the pandemic, but I think this past year we've seen an uptick in alcohol again as well, unfortunately, in kids. And the problem is that, if they're at a party drinking alcohol, there's also vape products there, and they may vape THC as well. So, you increase your THC levels when you have alcohol in your blood. So that does not help. And then, obviously, all these side effects that you can have can be more pronounced even with a small amount of marijuana when it's mixed with alcohol. And so one of the most important messages we can give to kids is these 3 drugs are gateway drugs. And we have to be firm on that because that is actually true. Now, they're not gateway drugs for everybody, so being honest, even if it's 1 in every 6 people who uses these things develops a dependence or an addiction, that's a lot. So yes, most people will not, but a lot of you will. And, your genetics plays a role. I really encourage parents to be very honest if there's a family history of any substance use, because maybe that'll make your teenager think twice that, oh, wow, so-and-so did have a significant problem with whether it was alcoholism or other drug use. And just, when we take care of our opioid use disorder patients, they all started with alcohol or marijuana. Every single one of them remembers their first drink or their first joint when they were a teenager. So, now I'm going to shift gears to talk about how we can talk to kids one-on-one, and what they believe and how we can, address those things that they'll tell us. So, this is one thing every teenager will say: marijuana is not as bad as other drugs. Yeah, it's not as bad, but it's still bad for you. So again, is your life better smoking weed or vaping weed or not? And would you rather jump off a 4-story building or an 8-story building? Let's compare, yes. And so you can agree with them, but hey, here's the facts behind that. Next. Marijuana is natural. I love this one because they'll all come, well, it's natural. Next slide. So are cocaine, heroin, and tobacco. So simple. That's a simple one to so is everything else. So is poison ivy. So are poisonous berries. So this is not anything new. Natural does not mean safe. And again, looking at this, the marijuana in the 60s was 1 to 3% THC. It's now 12%. That's not natural. That's called genetic engineering and modification. So I can't tell you how many kids will say, well, nicotine's addictive, I know that. Alcohol is addictive, I know that. Marijuana's not. But it is. Again, 1 in every 6 adolescents will develop an addiction to marijuana and maybe another substance later on in their life. No one dies or ODs like they do with other drugs on marijuana. So it is true. You probably cannot die if you overdose on marijuana, but you can get acute psychosis, which is very scary and very serious from anything. And these psychotic events can lead to something adverse. They can cause people to do things that they otherwise wouldn't do. This one comes up a lot. It's medicine. I know it's medicine for anxiety. I know it's medicine for depression. Well, THC is not a medicine. And under the age of 18, there are only 2 FDA-approved conditions you can use it for. And once I say these 2 names, you're like, okay, like nobody's heard of these before, right? So it's okay. But they are 2, common types. They're not common, uncommon types of seizure disorder, sorry. And these kids are quite developmentally delayed and have very retractable seizures. So, and you need a dosing regimen and a protocol for managing side effects. We don't have that for marijuana. And there's no evidence at all that any of these conditions like chronic pain, depression, or anxiety are actually improved when someone uses any kind of THC product. And finally, remembering back to the 1950s, there were plenty of medical professionals who told the public that nicotine was healthy for you. Marijuana is now legal, so it's okay. I can use it as much as I want. Again, just like natural, legal does not mean it's safe. There are plenty of legal things that I'm going to talk to kids about that aren't good for them, and alcohol and tobacco being them, energy drinks, there are a whole number of things out there. So this is for your health I'm talking to, not whether it's legal or not. So marijuana withdrawal. This is really challenging because kids do experience it, especially those that have been using for a number of months. And if they stop suddenly on day 1, they're going to get that anxious, irritable feeling like nicotine, have trouble sleeping. They may get some more cravings for it. They may sweat. They may get chills. But it's that long-term effect of it where they can develop significant symptoms of depression after a few days of not using marijuana, which is really, really challenging because what is their brain telling them? To go use that THC again. So how can we treat these kids? Because this is really challenging to treat. We don't have great evidence-based protocols yet for this. But what we can do is do motivational interviewing, just like we do for nicotine. There is an approach called ACRA, the Adolescent Community Reinforcement Approach, that is done by trained mental health clinicians. It's a 14-week therapy module that they do. It has parental involvement in it as well. And of course, we have to treat underlying depression and anxiety, especially that depression that may come from withdrawal. And this is not a sudden, snap of the finger treatment. This can take months too. It's not going to happen at the first or second visit either. If we take anything away from today's talk is that parents play the most important role in their kids' lives, and they tell us that all the time. And we know that parents who are involved in their kids' lives have a 40% less chance of using substances. So just let them know you're on your side, that everything that you're doing is to care about their health. And if they do use something, you're going to be there for them, non-judgmental, non-punitive, and really work with them for their health. How do you talk to them again? Those simple questions. I know you're smoking marijuana. I want to help you. Tell me, was your life better with or without it first? Have them, start thinking about this. What motivates you? Is it your academics? Is it your sports? Do you want to save money? What is it that you want to improve in your life? And then drug testing. So many people talk about drug testing. I really discourage parents from buying drug tests online or at CVS and using them on their kids. It generates mistrust, and that's what you don't want with your kids. Let us talk about drug testing. That's our job. And we'd be happy to talk to them and drug test them if we feel like it's needed. Because honestly, your teenager knows ways already of how to cheat a drug test. It's simple, it's easy. They can cheat a urine drug test, they can cheat a salivary drug test too. If I swabbing their mouth, there's ways you can cheat that as well. So yeah, scary that they can do that. But so leave the drug testing up to us. All our parents should be doing is talking to their kids. So what is one thing that really, really matters? That is the importance of connection. Kids need connections. And we know this we know this from data. We know that if kids have a mentor who can give them non-judgmental support, they're more likely to do better, both from a prevention standpoint and a treatment standpoint. That person can be at school. That person can be part of a faith group. They can help them with their homework. They can do other activities with them. They can work out with them. They can have them do volunteer work. Volunteer work is actually a good antidepressant in and of itself because it stimulates that same reward center in your brain. So really giving kids these outlets works really, really well. It's been proven to work well. So one of the things, for schools especially is to have each kid see if they find a trusted adult in the school. Teacher, coach, cafeteria staff, whoever it might be, they need that trusted person at school. And what can we do as parents? Because I think, while we talk to our kids at an individual level, we all sometimes get frustrated that it's so easy for them to buy things online, or we see these billboards, or, it's advertised everywhere. We can work with our local boards of health or our state. Let's limit advertising. Let's have labeling of our THC products so that we can know what's in them. Because, kids will say, oh, I trust what I got because I got it from a friend who I know wouldn't give me anything bad. Then ask them, where did that friend get it? Oh, I don't know. So, the chain of where these things go. Or it's from a dispensary. It's got to be okay. But those products don't have clear labeling on them, so we don't know what's in them. And child-proof packaging, although we are at a high school, we all know that younger kids are getting into edibles as well and ending up in the ER. So we do need packaging that the young children cannot open. And the flavor bans, we have them on tobacco, and it's been successful in terms of nicotine vaping because there's no longer that enticement because it doesn't taste good anymore. So the same thing with THC will really help us. Obviously more funding for prevention programs. And I know some municipalities have banned, I don't know what Blackstone Millville have done, but have banned, sale of recreational marijuana. Because that's a big thing. A teenager driving by a recreational marijuana dispensary a mile from their high school is obviously a very, very, serious thing because they're gonna see it right there. So in conclusion, nicotine addiction and cannabis use disorder, they're all preventable. And that's the sad part, is we can all work to prevent these kids from getting that way. And how young does it have to start? Honestly, they know more than we do at any given moment. So even if you start with your 11-year-old, that's okay. They probably have already heard about a lot of the things that you don't realize that they know. So start having that discussion with them. It is never too early. And we have to model our behavior. That is so important as adults because they listen and watch. And so every time an adult says, I need a wine tonight to relax because I had a rough day at work. That light goes on in that kid's brain. Let me vape my THC. So because I had a rough day at school. So we really have to watch what we do and model what we do. And if we drink a beer and then start driving, what does that show our child? That's what they've seen that already, so they're more likely to imitate that. And again, parental behavior, parental actions are the #1 influence on kids. We talked about connection with trusted adults. Again, that is so important. Finding that person for them is key, wherever that person may be. And even within the community, do they have a faith group that they connect with? Do they have a sports team? Do they have friends in their neighborhood? Really getting to find what's there for them that's positive in their lives. And we have to screen these kids early so we can intervene. I mean, I applaud high schools tremendously for taking on the task of substance use screening. It is not easy to implement that questionnaire. It's huge kudos to all the school nurses and everybody that does that, because it is huge, and it does offer us the chance to make an intervention. We do the same in primary care every year. They get screened 12 and above for any substances they might be using. When you see somebody who doesn't use it all, there's still intervention to be made, because there's still praise to be made for not using. Hey, this is an amazing decision you made for your health. Just like you sleep 8 or 10 hours a night, just like you eat a healthy breakfast. Awesome for you for not using these substances, because that is something that I want you to continue throughout your adolescence. So these are things that are really important for us to really emphasize to our kids, even the ones that are not using. And if they are using, and we find that they are, that's when we start making those interventions that I talked about.